With the necessary infrastructure, expertise and legal framework now in place, Uganda is closer than ever to performing its first liver transplant, a procedure critically needed by patients with end-stage liver disease.
The preparedness in terms of infrastructure is already there. Also in terms of human resources are already there. So only what's remaining is this small piece, which is really the remaining dot for facilitating the organ transplants in this country. When this happens, definitely, then will first be available, because there are many patients who are really in the waiting list. The costs definitely will be much more cheaper, but also we will think that even other patients within the region should be able to access these services.
The path to initiating liver transplants in Uganda has been a long and comprehensive one, involving multiple stages of preparation.
Lago National Referral Hospital, after the renovation and remodeling, established an organ transplant unit. Currently, we've already done the maiden kidney transplant, and it's the same facility that would support the transplants of other nature.
Professor Moses Galukande, President of the Association of Surgeons of Uganda and a surgery professor at Makerere University, emphasized the strides reached at in training and capacity building.
And we have surgeons that have been trained, but we also have collaborators. Collaborators means other people that have been doing this for a long time. And often when you're doing something for the first time, even if you're trained in it and you've done it in other contexts, you ask those people to come along with you. That one is all available. The bill was passed, the spaces are there, but we need a few legal and administrative things to be sorted for us to do this. And the patients are there. Yeah, and the things to use are there. So it is a few months away.
Government has also passed a law on human organ transplants, later assented to by the President, which establishes a framework for a transplant council to oversee and regulate transplant activities.
All we are waiting for is for the Ministry of Health to set up a transplant council. And I heard that they had requested for 5 billion, which Parliament didn't approve. But we pray that Parliament approves this 5 billion so that once we can, the human resource is already here, and the hospitals have already invested money in equipment and infrastructure to build a transplant theatre, which is evident in Rubaga Hospital and in Mulago. Now all we need is the supporting legislation and policies from the Ministry of Health, and one of them is that Transplant Council to oversee it.
The local availability of liver transplants will increase patient survival rates and significantly reduce treatment costs, as patients will no longer need to seek care abroad.
In Africa, the main countries doing liver transplant we have 2 centers in South Africa, that is in Cape Town, and then Johannesburg, that is in Wits. And then Cairo has over 20 centers doing liver transplant. And then we have liver transplants that have been done in a few isolated countries. Algeria has a liver transplant program. Recently, my colleague whom I studied with did a liver transplant in Ghana. And there was also a transplant that was done in Côte d'Ivoire. So there are not many countries that are doing liver transplants. But so we will be the first in East African region, and we are ready. The beauty with us is the President trained over 15 surgeons in this aspect. So it's now the policies that are delaying us.
Sudat Kaye, UBC News.